Hello, my name is Sharon, and I will be speaking on the Medicaid expansion program. Low income adults are showing an enormous amount of support for the new Medicaid expansion program. The Medicaid managed care insurers are offering health coverage to the general public. I am qualified to speak on the managed care expansion program because I was without health insurance. I was a single mother, just purchased a brand new home, was laid off from my job, no medical insurance, and had two children to take care of. I went to seek assistance from the state, was denied because my unemployment was too high and I wasn't able to receive the medical insurance that I so deserved because of my health issues. With the new Medicaid Medicaid expansion program, people who are underinsured and who are uninsured are able to receive health care. This speech will focus on the managed care expansion program that embraces the poor and a new Medicaid expansion program and the gap left without the Medicaid expansion program. The Medicaid expansion program is embraced by the poor. Under the Obamacare, states can choose whether or not to expand the Medicaid to adults without income, with income below 138% below the federal poverty level. So far, 27 states and Washington, D.C. are expanding to the Medicaid expansion program. The other states are having controversial issues with the new Medicaid expansion program. Roughly 75% of those surveyed describe Medicaid as good or better than private insurance in terms of quality of health care. Favorable views toward Medicaid were most common among racial and minorities, people with less education and low income, and the poor in health. The state respondents' awareness of their state's actual expansion plans was low. There is a different kind of Medicare, there is a different kind of Medicaid expansion program. The Medicaid expansion program has a growing number of Medicaid managed care insurers have approval from the state regulators and insurance exchange officials to enroll non-Medicaid members on the exchange, making the first time of these specialists insured will be offered health coverage to the general public. These insurers are rolling out new plans that meet the benefit of other requirements of the exchange, which were established by the Patient Protection and the Affordable Care Act. The expansion of Medicaid managed care insurers into the non-Medicaid market holds a clear financial promise for insurers. Medicaid managed care plans received 108 million out of the 435 billion spent on Medicaid normally. The congressional budget offers projected that 7 million people will sign up for coverage through the state exchange in 2014. 25 million will be enrolled by 2023. The gap left without Medicaid expansion, since the states have so far chosen since half the states have so far chosen not to expand Medicaid, 5 million adults fall in the coverage gap between those eligible for traditional Medicaid and those eligible for subsidized for private insurance under the Affordable Health Care Act. Nearly 4 million people who suffer serious mental illnesses and substance abuse disorders fall in the gap, according to the American Mental Health Counselors Association. States that chose the expansion of Medicaid will see an economic benefit because of the decision, according to the data compiled and analyzed by the Kaiser Commission of Medicaid and the uninsured. States that do not expand Medicaid forego increased federal funds and associated new jobs. The Medicaid expansion was embraced by the poor along with a different kind of Medicaid expansion program. The gap left without Medicaid expansion shows the need for more people to be insured. In conclusion, low-income adults have shown an overwhelming amount of support for the new Medicaid expansion program. Managed care insurers have offered health care coverage to the general public. The results showed that the respondents have significant medical needs and many financial barriers, meaning the Medicaid expansion program has all the more potential to benefit low income, the uninsured, the underinsured, the poor in health, the benefits that they need.